thank you all for joining us today. We are looking forward to sharing with you some project updates, but also sharing with you the results of the survey that we sent out that was focused on residents in the Foothills area, which is of course the area that this project focuses on in terms of what the impacts of COVID-19 have been. So we will first get started by just sending our thanks to those organizations that have helped to fund this initiative. So the Jolly Foundation, Margaret Linder Southern Endowment Fund of the Community Foundation of Greenville, and Greenville County First Steps, as well as John I. Smith Charities. We're very grateful. So we will start out with a project overview, and then we will jump right into what we've seen the impacts of COVID-19 to be. Then we'll continue with a brief project update and open it up for questions and answers. And so even though we have a Q&A section, please do feel free to ask questions at any moment, or give your comments. We're flexible with that, so don't feel like you have to hold it to the end. If you want to hold it to the end, you can. If not, we're happy to engage with you during our presentation. So now for our project overview. So some of you may know, especially if you attended the listening session that was in November, that this initiative, which we're referring to as Hello Family Foothills, is inspired by the Hello Family Spartanburg Continuum of Services that I've been referring to as soon to launch for a while, but it really is soon to launch at this juncture. And here you'll see a bit of an outline or visual representation of what it is that the continuum entails. So when we speak of the Hello Family Foothills project, our overall goal is to improve outcomes for young children and families in the Foothills area. Of course, being an early childhood organization focused on ensuring the success of all young children, it's always our goal to improve outcomes for young children and their families. So in this case, we're focused on the Foothills area. So as you'll see in this diagram, the Hello Family Spartanburg Continuum that has inspired this initiative is a proposed continuum of support for families in the city of Spartanburg. And so what that means when we say continuum is basically from the moment that the child is born, or really even before that, in the prenatal time, there is support provided. And so it goes from stage to stage up through age 5. And so you'll see that there are 3 categories: home visiting, parent education and support, and then of course early learning. And you'll see under each one what the programs are that will be offered in Spartanburg once the continuum is launched. So this is the image, or this is our ideal. This is what we had in mind when we partnered with the City Council and Travelers Rest and decided to go on ahead and pursue this initiative to see if Pay for Success, which is a form of outcome-based financing, would be a good fit for launching this type of a program. So it doesn't mean that if this were to launch in the Foothills section of Greenville that it would be these exact same programs. We have to look at what the current need is, as well as the capacity and what it makes the most sense to implement. But this is an example of what a continuum of services that supports young children and their families could look like. So when we think about the Spartanburg Continuum of Services, oftentimes it makes sense to kind of visualize what it looks like if someone named Sandra was going through the continuum in Spartanburg. So let's say that Sandra is an expectant mom living within the city of Spartanburg, and she learns about the services that are available to her while she's still pregnant: Birth Matters and also Text for Babies. So one being a doula program, and then the other a support system, electronic support system, which is, I imagine, to be very useful now during COVID-19, that sends updates about what to expect and things to look for depending on where Sandra is in her pregnancy. So next, Sandra gives birth to the baby. Eventually she goes back to work, and she's nervous to leave Xavier, which is the name of her son now. But she loves the childcare center that is a Quality Counts childcare center. So now we're looking at having access to quality childcare, which many families do need. And so as Xavier grows up, Sandra has some more questions. She wants to make sure that she is being the best parent that she can to her child. And so she and the child's father attend Triple P seminars to help them with their parenting, let them know whether or not they're heading in the right direction, and just to provide general parenting support. So again, this is an example, a visual representation of what it might look like to go through the Spartanburg Continuum of Services. So now going back to Foothills, which is of course our focus for this particular initiative, these are the three areas that we are looking at in terms of whether or not this is something that could be valuable, and also, you know, whether or not it is something that is possible to be implemented with outcome-based financing. And so the three areas are Marietta, Cleveland, and then also Travelers Rest, just to give you an idea of what part of Greenville we are looking at. So in November of 2019, which feels like a very long time ago now, we did hold a listening session with stakeholders. And so what we did during that listening session was share the vision that we had for Travelers Rest. And this isn't one that we necessarily created on our own. There were meetings with the city council months before this listening session happened. So basically us kind of hearing what the needs were, seeing what the needs were, and also committing to further researching what those needs might be. We gave an overview of what we refer to as Pay for Success. We won't be giving an in-depth overview of Pay for Success financing during this presentation, but the basic thing to know is that it is a form of financing that can help to fund programs, evidence-based programs that are effective for young children and their families. So the way that this kind of financing works, investors put up the upfront capital, and as long as the outcomes are met, then the government is on the hook for paying back. Normally the government, it could be another entity, is on the hook for paying back the investors the money with a very small return. So the idea is that we choose programs where we are very confident in the outcomes that we will see. We're very confident that these are programs based on the research, based on our analyses. We're confident that whatever programs are chosen, they will actually, that will actually see the outcomes. So it's a very heavy on research and outcomes as opposed to outputs. So that's kind of like the very quick version of a Pay for Success 101. So during our listening session with stakeholders, we also got into a bit more detail about the Hello Family Spartanburg initiative. So again, some of these things we're not going to go into too much detail today, but if you do want more information, we have those items on hand, and we are happy to send them to you once this webinar is complete. All right, so moving along. So of course, we have been working on this initiative for the past few months, conducting different analyses, attempting to do stakeholder outreach, and in an ideal situation, we would have had many more meetings in person and otherwise than we have had. But as we all know, by March, many of our lives looked vastly different because of COVID-19. So we want to pause a bit to get into what the impact of COVID-19 has been for the area that this project is focused on, because this is something that, of course, we're concerned from the basic level of, well, this impacts children and it impacts families, but it also impacts the flow of this initiative and what this project looks like going forward, and how it has looked also for the past few months. So we'll get into a bit of that, and the findings are interesting. And yeah, so we'll go ahead and get into those findings. So first off, you may be wondering who exactly took the survey. So here is the breakdown. The most represented zip code will be the 29661 zip code, and you'll see that there are others as well. So as a general overview of how COVID-19 has affected the Foothills region, we did ask respondents to, tell us if it has affected them positively, if there has been no effect, or if it has affected them negatively. And here you'll see that 59% of respondents said that COVID-19 had a negative impact on them. 33% said that there was no real effect, things were pretty much the same, and 8% of people said that they had a positive that COVID-19 had a positive impact. So you'll see here that we also wanted to know what things look like financially for families before COVID-19. Were families mostly secure, not really financially secure, or somewhat secure? So we'll see here that 83% of respondents identified as being financially secure or somewhat financially secure. And we see that 17% indicated that they were not really financially secure before COVID-19. So now looking at when COVID-19, basically when quarantine began, when we realized that this was something that we should all be concerned about, we see that 33% of survey respondents indicated that they were worse off economically as a result of COVID-19. That at least 67% of respondents saying that they were about the same financially. So we looked into this a bit. Some of this may be a bit surprising. I don't know. We might have expected that COVID-19 might have, posed a bigger financial toll. It is also the case that, and I should have said this sooner, we did not put out a survey expecting it to be something that could be statistically significant. We didn't expect it to be the appropriate sample size, any of that. We expected, though, that we would kind of begin to get an idea of what the impact of COVID-19 has been. So again, this is not something that's meant to be statistically significant, and we shouldn't take it that way. But we did decide to dig a little bit deeper and look at what, whether or not there were any disparities, what things, looked like when we divided respondents into those who said that they were secure before COVID-19 versus those who said that they were not secure before COVID-19, and what their post-COVID-19, or I should say during COVID-19, because this is still a present thing, what their financial security looked like now. And so we do see a big disparity. So what this chart shows, what this bar graph shows, is that 100% of those respondents who indicated that they were previously not financially secure are worse off. So every single person that said, all 33% of people who said previously that they did not feel financially secure at all, now say that they are doing worse financially. Whereas the individuals that indicated that they felt secure or somewhat secure, only 20% of them are now saying that they are worse off financially. So what this tells us is that in the case of the respondents, those individuals who were not secure before COVID-19 already might have been experiencing some financial struggles, ended up faring even worse than before as a result of COVID-19. Okay, well, I will turn things over to John to go through the rest of our impacts.
Sure. Hi, everyone. So in addition to asking about everyone's financial outlook before and after, we also wanted to dig into how they felt about their housing, since child homelessness is one of the indicators of the Hello Family Foothills project for now. And we asked if they expected to be living in the same place a year from now, or if they were unsure as a result of COVID. Fortunately, 92% of the respondents said that they expected to be living in the same household as they were now, with only 8% of unsure where they would be living. It is tempting to want to draw conclusions from this figure or compare them to, say, the child homelessness figures from the school district in those areas, or homelessness over the county, or housing insecurity. But we feel as though this is simply a snapshot of residents of this area, independent of other trends at this moment. This is just to get a sense of if there was a big red flag that we needed to look into. This looks nothing was shocking about this, I guess, is the conversations that we had internally. moving on to the next one. What we did find out, though, is that if you'll remember back, 60% of respondents felt that COVID impacted them negatively, yet 67% indicated that it didn't have really a financial impact on them. And what we realized in looking at this data is that there have been intangible effects on people's concern for their children or housing or healthcare or things like of that nature. So overwhelmingly, 86% of respondents felt that COVID-19 had a negative effect on children. And this discludes individuals who do not have children under the age of 18. And conversely, I guess only 14% felt that COVID had a positive effect on their children. We asked about people's concern for children's health, if they felt more concerned, the same level of concern, or felt good about their child's health as a result in the context of COVID-19. 14% said they felt good about their children's health. And then it was split between the remainder, of 43% indicating that they were more concerned about their children's health, with 43% also indicating that they had the same level of concern as before COVID-19. And again, these are only representative of those children of those respondents with children under the age of 18. There was interesting information on children's education. We asked, again, the same parallel type of question. Are you more concerned about your child's education, same level of concern, or felt good about your child's education as a result of COVID-19? There was half of those who responded felt that they were more concerned about their children's education, with a quarter each on the others. Some of the subjective feedback that we received was concern for virtual learning, social isolation for their children, the transition from middle school to high school or high school to college, sort of being outside of anything that anyone had experienced before. And now since this was done when children were back in school, there was also an express concern over parents' ability to provide for their children's educational needs since they were increased at home, while also maintaining their careers, keeping their jobs, and keeping the house moving as they did before. Yes, parallel to the education question, we just broadly wanted to ask about how people felt about their children's future, inclusive of all the things. And we purposefully kept it broad just to get a sense of how people generally were feeling about the next few years. And they mirror the education ones. 50% were more concerned, with a quarter each in the other two. This also is expressed in the subjective information. There was a lot of stress coming through the narratives. Things like we mentioned before, childcare, and then simply the educational things. But it wasn't focused so much on like grades, for example, were not the main concern. It was things like mental health or children's socialization, things of that nature. One thing that did stick out to us, though, is that we asked broadly about mental health becoming a concern as a result of COVID, and 75% expressed that there was concern for at least one person in their household as a result of COVID-19, which is a pretty striking number when we pulled that information and looked at it. And I think that wraps it up for my section.
Thank you, John. So in this section, or on the slide, I should say, we wanted to share a few of the stories that we heard from the respondents. Some of these things are not so surprising. A few of them I found to be a bit surprising. I think one of the things that surprised me in a good way, that it would be brought up in a survey like this. There is I think it's a comment to the upper right that says that COVID really forced the families to kind of hit a reset button, and that they spend more time together now since COVID-19, just because of things being shut down and quarantine and schools being closed and then open and then closed again. And so some other comments: my youngest is also craving human connection, especially with her peers. Another comment: my high school student has thrived on the hybrid school schedule and is more motivated to complete work because school is not dominating his time. However, my college student was not doing as well mentally, being stuck at home, and is now doing great in her independence back on campus. So just to see kind of the juxtaposition between children of different ages and how they're doing. Another one: concerned about childcare when children are out of school and I still have to work full time. Another comment saying, I will have to quit my job so that I can provide full-time childcare for my child. I think we've heard a lot of this. This will be a financial hardship for our family. So those are just a few of the stories. We will, of course, provide this slide deck to anyone who registered for this webinar, so you can get to read everything in full. So moving along to our project updates. So as you can imagine, COVID-19 has really impacted how we've been able to go about this work. There are stakeholders and partners in this work who have had to understandably turn their attention elsewhere, right? So if you're affiliated with a school and this is happening and your school suddenly closes down and you have to figure out how children can learn from home effectively, that's going to dominate time. When the fall rolls around, you have to figure out whether or not you can open the doors, and what do you do if you don't. That also dominates time and becomes the priority, and not necessarily, speaking with us. And of course, we haven't had many in-person meetings, none since March, because of COVID-19. So we will go ahead with some updates, and a bit later on in the presentation, we will talk more specifically about challenges that we face, and many of them are because of COVID-19. So I mentioned earlier that we did have a listening session with stakeholders in the community in November, and out of the discussions that we had at that listening session, also before and after the listening session, and also as a result of the research that we have done about the Foothills area, these are the 5 outcomes of interest that we have gathered. Kindergarten readiness, 3rd grade reading, access to quality childcare, homelessness, and maternal or parental depression. So when we look at this potential financing mechanism that we call Pay for Success, and I stressed earlier how important it is to be truly confident in the outcomes for this type of financing mechanism. And that's a good thing, of course, because if we implement programs, we want them to be effective. So, but when we have such a strong focus on outcomes, we have to look at things like measurement. Can these outcomes be measured in the Foothills area, similar to how they are measured in the research? Because this tells us, if the answer is yes, this tells us, we have more confidence that if implemented in a similar fashion, that we can then be able to see these outcomes and that the implementation will be successful. But if we either cannot measure the outcome or not in a similar way, then, our level of confidence decreases, and we don't know if this is something that we should pursue for this particular project, for this particular mode of financing. And so if you look here, you will see the different ways of measuring each of the outcomes. And, we'll talk a bit more about baselines later on. As you can see, in most cases, in that final column, all the way to the right, we don't have the data, these data. And the reason for that, in many cases, is that, if you look at something like 3rd grade reading scores, well, there were for the 2019-2020 school year, many of the South Carolina standardized tests didn't happen because there were no protocols for administering those kinds of tests at home, which is where the children had been since about mid-October. Sorry, not October, March. Don't remember the exact date, but it was March. So, that is a challenge, and we'll speak about it a bit more, but I just wanted you to know why that column looks that way. We had a similar thought pattern for kindergarten readiness. When we look at child homelessness, it comes with a reminder that homelessness in general is generally under, something that is, when we see the measurements, when we see the rates and the numbers, we know that it's something that's still underreported, and more than likely, the baseline numbers are higher. The rate of homelessness is generally a bit higher than what we see. And that is something that is not specific to South Carolina, but just across the board with homelessness and how it's measured in this country. It's typically underreported. So looking at the outcomes that we have decided upon at this point in time, there are several potential programs that we are considering. And so when we think of how to achieve the outcomes that have been mentioned, we have to think about what programs have been known to have those outcomes as a result of their implementation. And so some of these programs are already existing in the foothills in Northern Greenville area, and others are not. And we would have to, it would be the first time they were implemented in the region. You'll also see that some of the programs are kind of more local and homegrown, like the child care program at Marietta First Baptist Church, and others are more national programs like Head Start and Family Connects. And Nurse Family Partnership and Healthy Families America. So these are just some of the programs that we are considering. Programs like Family Connects, Nurse Family Partnership, and one or two others are home visiting programs. Head Start is an early learning program. But what we'll see is that, with a home visiting program, for example, of course, there are outcomes that are related to, health of the mom and health of the child, but outcomes generally go far beyond that as well. So for each individual program, they may actually produce more outcomes than we might think initially. And so that's why the research is so important. Thankfully, we are very familiar with many of the programs on these two lists.
So we did identify some challenges moving forward. The first, of course, is COVID itself. The unknown nature of this just sort of puts time into a vortex that we can't really begin to predict. So, for example, we're unsure about how long this thing is going to go, and even if it were to quote unquote end and get a vaccine, how long that would take to deploy, and what, of course, the different focuses of everyone are going to be coming out of this. The second, a little more practical, was that we began communicating with principals of elementary schools in the area, and initial feedback was very positive, but we weren't able to complete those meetings. They were scheduled actually for the week that the school shut down. And so those meetings have obviously been postponed indefinitely for the time being. So we know the school district's buy-in and support will be critical in connecting the programming for 0 to 5 to the schools, especially since the schools district is measuring this 3 out of the 5 things that we are measuring, that being homelessness, third grade reading scores, and kindergarten readiness. The third is something that cuts across all programming, is communicating with families and ensuring that awareness is built and access. It is a rural area, and in working with the major organizations that are up there, like Foothills Family Resources and Slater Elementary School, we have learned that electronic information is not always the most efficient means of getting the word out. And so that is just a known challenge walking into it. The fourth is tied to the first one. Of course, because of COVID-19, there have been some very pressing issues, things like housing, food, how we're going to help children navigate the day, that are focusing the community in on very specific things, which then as a result pushes other things to the back burner. And so in order to keep focus on things that we know were an issue before COVID-19, they're an issue during, and they will continue to be an issue afterwards, we are recognizing that this narrowing of the community focus and priorities is not necessarily a barrier, but it is something that we will need to contend with in order that we don't get stuck in the place of emergency needs and only the short term. And the fifth is that in order to do a pay for success assessment, usually we need 3 years of baseline outcomes. And as we showed you in the slide before, we are without the 3rd year. There are a couple of issues with that, in that we had to start in 2 years previous because some of the measurements changed in those years before. So in other words, we had to start in year 1 in for example, like 3rd grade reading scores because assessments changed and they are not parallel outcomes. So we are hoping that some of them will come out, things like maternal depression. We should have a homelessness figure, we think. But without 3rd grade reading being administered and without kindergarten readiness being administered, we're hopeful that some way this year there may be a way to administer those. But even so, given the effects of COVID, we're unsure if how indicative those outcomes will be of what is actually happening. In other words, they might turn out to be an anomaly. Moving to the next, or I think we have a poll next, is that correct? So we wanted to ask your feedback on this. ICS, of course, is focused on children aged 0 to 5, sometimes 0 to age 7, depending on how we define early childhood. And we're feeling the need to go into a multitude of directions. And so we wanted to ask you to prioritize for us, just for some feedback for us to consider. And the choices being concentrate on sort of the most pressing needs over the next 2 to 3 months, things like food, medical health, housing, or continue to focus on the less urgent issues, but the things we all know are issues and have been issues, things over the next 12 to 24 months, or the third is to endeavor to resolve both of these things and work in both of them. So if you would please vote. Thank you. So if in case we can't see the results, 67% felt that we should focus on both, with the remaining others splitting the vote from there. So 17% and 17% for the others. Thank you very much. The next steps in the timeline. So before COVID, around this time, we had planned to introduce the plans to principals and recruit their support and develop a relationship. The second part of that plan pre-COVID was to secure the third year of outcomes, things like kindergarten readiness, child homelessness, and produce a feasibility plan, with then the third step being continuing to identify resources for potential implementation. These things might be programs, local resources, local assets, things of that nature. As a result of COVID, though, this pre-COVID plan changed. So as a result of COVID, realized that we needed to perform this survey, find out, at least initially, how everyone was feeling, their experience, which would then tell us where to go from there. The second part is to work in tandem with the school's COVID response and stay in close touch and provide resources as they are needed. And then in addition, ICS, because we have been sort of dipping our feet into the water with this, we have been working closely with local organizations in the area. Organizations like Foothills Family Resources, they are looking at bringing in childcare to the area. The Slater-Marietta town organization is talking seriously about child homelessness, and we have a presence with them as they continue to have that discussion. So from there, we're happy to answer questions or your comments or your concerns. And are we doing this in the chat or Q&A or?
Yeah, either one, either that they come through. But yeah, if you've got questions about the impact of COVID-19 on financial, education, well-being, mental health, please ask. Are you able to share any more details around the timeline for this HF Pay for Success project in Spartanburg or the Foothills? For the Hello Family Pay for Success project in Spartanburg or the Foothills?
So I'll bite. So for Hello Family Spartanburg, it is likely that the program, that the Continuum will be able to launch at some point in 2021. As you can imagine, you know, there's a lot of uncertainty around the timing of funding and things like that, but we are cautiously optimistic, I think would be the term, cautiously optimistic that the Spartanburg Hello Family project might be able to launch come 2021. As for Hello Family Foothills, we are in this, what we're conducting right now is a feasibility study to look into the possibility of using Pay for Success financing to expand, to expand some programs and to maybe have a continuum of services that helps to improve outcomes for children and families. So we don't know definitively that it will be a project that is launched in Foothills and implemented, but what I can say is that the feasibility study will be wrapped up within the next 2 months.
Okay. There's another question. It says, have you been in touch with school principals to see if they are interested in this project and see it as a COVID-19 form of assistance?
Sure, I'll take that one. So when we began conceiving of the survey, we were in touch with the school district to ask them if they would like to participate and help us distribute. And the feedback that we got from them was they were so concerned with simply getting the schools open, getting kids there safe, and all the different things that was going to take, that they requested that we wait to be in touch with the principals until after schools had been opened and after they had seen that their plan was going to generally stay on course, if you will. So we're set to circle back to them sometime mid-October because it feels as though the school district has gotten into a rhythm, fingers crossed that continues. And so yes, no, but then yes is the answer to that question.
So thank you all for joining us. And we know that sometimes you're in the middle of a webinar and you don't have all of your questions together, but afterwards you have a bunch of questions, a bunch of thoughts. Do feel free to reach back out. I know that Lisa is very good at sending around our slide deck and linking everyone to the webinar recording after the webinar. So you should be getting that pretty soon. And yeah, we're happy to answer any questions after this moment, or to even hear your thoughts on this project, anything that you think we should know as we move forward. But I think the important thing to note is that, even in the midst of COVID-19, we're still pushing forward, we're still moving forward. And the minute that we are able to meet with stakeholders again, that's exactly what we'll be doing, because it's very important for us to keep those modes of communication open and to have those conversations and input. So thank you, everyone.